Hi everyone, this is Bella Mehta reporting from Eular 24 for Room Now. I'm from New York, and I'm very much interested in Still's disease, and I came across an interesting abstract for Still's disease at this conference. The abstract number is 001, and this is a multi-center observational prospective study where they pooled in patients from three different groups to get like around 600 patients of Still's disease, which is a sizable number given that Still's disease is a rare disease. And the study aimed to evaluate the clinical usefulness of a systemic score in predicting two important life-threatening complications. One is MAS or macrophage activation syndrome, and one is mortality. So, like I said, this was around 600 patients with Still's disease, average age around 36 or 37 years. Again, much younger cohorts than what are reported in the US inpatient population and some of the other studies. But this seems like what most clinics would be seeing, a younger cohort with around 44 to 45% males. Again, much more female predominant in this cohort again, Still's disease is characterized by fevers, joint pain, and rash. Fevers were 100% in this cohort, joint involvement around 89%, and skin rash around 66%. Some patients also had a liver involvement, but the numbers were pretty striking, around 44%. So the threshold for saying liver involvement seemed to be pretty low. MAS was in 13% of the patients. Again, this is a difficult clinical problem and difficult for patients and difficult to manage this clinically. So it's important to know how to predict it. And lung disease, again, sort of showing a trend from pediatric Still's disease to adult, even in adults showing around 7% lung disease. The overall mortality rate in the cohort was around 3.4%, which was attributed to Still's disease. And again, this is similar in numbers to some of the other literature out there. But the one thing that they could figure out was a systemic score, which could be a significant predictor for these life-threatening outcomes, MAS and death. The odds ratio was around 1.24, which was after adjusting for age, sex, inflammatory markers, ferritin level, which is pretty robust a model to work with. Specifically a systemic score of 7 or higher increased the likelihood of severe outcomes by an odds of 3.3 or 4%. So this, this score actually has a lot of clinical utility when you're trying to predict or identify these high risk patients, and maybe those are the patients that need to be aggressively treated. This study also highlighted that liver involvement and lung disease themselves were independent predictors of life-threatening evolution. And detailed analysis also showed that patients with liver involvement were more likely to also have lymphadenopathy, splenomegaly, pericarditis, pleuritis, um, and uh, and those with liver abnormalities also had the same pericarditis, pleuritis, and abdominal pain. Um, the one thing sort of takeaway for me was that lung disease, just having lung disease with adult onset Still's disease, increased the mortality odds by 3.6. Again, I know there's a lot of focus in the pediatric world with lung involvement, but I think we need to start focusing even in the adult world and screen these Still's disease patients, either at least to begin with a chest X-ray and maybe other modalities like CT scans. All in all, it's a very robust study providing a systemic score, highlighting liver and lung issues in Still's disease, and also gives you a practical approach to stratify these high-risk patients. So with that, I'm signing off. This is Bella Mehta, and to follow me for more updates, follow me on Twitter, Bella_Mehta. Thank you.